During the COVID-19 emergency, news has been key not only to help distribute important information and messages, but also help keep the calm. Traditional newspapers are somewhat being replaced nationally and locally with electronic versions, but not all have. In Eastern Ontario, the Ottawa Valley, they have retained most of the papers, but not all of them have made the switch yet. As a result of that, we've had the opportunity to speak with Hollie Pratt-Campbell, who is the digital editor for Inside Ottawa Valley. Hollie, welcome, and thanks for taking the time to speak with me today.
It's my pleasure.
Great. So, Hollie, to begin with, how different is this from the pre-pandemic emergency activity? What changes have you seen, both expected and unexpected?
Oh, it's very different. It's like our jobs in a way have been turned entirely upside down. And just in terms of how we're working. So we're all working from home, just like everybody else. A lot of the people that we're interviewing and trying to get information from, like public health officials, politicians, those types of people are also working from home. Also the coverage, what we're covering is about, about 90%, 80 to 90% COVID related stories, because that's pretty much what's on everybody's mind right now. So huge focus on that. In our papers and also online, we've been running special sections each week. So each paper is a theme. So that we had our Salute Our Frontline Heroes theme. We had our Keeping Your Seniors Safe theme. So the papers have kind of shifted more towards that for the time being. Whereas in the online world, it's that plus a lot of breaking news. News is always a fast-paced industry. Things are always changing quickly, but I don't think things have ever changed at the rate that they are changing these days, and it's just constantly being top of those updates. So yeah, it is very different, and we're just trying to embrace it and trying to stay true to those journalistic ideas of, bringing people the truth, bringing people information, telling the stories that people need to hear, these stories of our time. So that part has stayed the same.
Without spilling any trade secrets, what are your sources of information?
Public health websites, the Ontario Public Health website. So every day I go to those sites and find the information, the updated information for our local areas, as well as for the rest of Ontario. Also, the public health officials are the ones that I've been talking to the most, just for my contribution to our team. Dr. Paula Stewart, in particular, in Leeds, Grenville, Lanark. I've been talking a lot to her. Um, More widely speaking on our team, we've had reporters talking to frontline workers, PSWs, nurses, trying to get their take on things. And we've also reached out to the community. So we've done a few stories about someone who was waiting for their test results, a prominent community member in Perth who had passed away. So it's trying to get both sides of looking for the facts, looking for the numbers, looking for the trusted information that people are craving, and then also telling the human side of the pandemic.
Okay. Separating fact from fiction has always been a key role in the news industry, and if it's not been the primary function, with a lot of the information that's been spreading around lately, as just look south of the border every day, there seems to be new information coming from certain sources. How difficult has it been to fulfill this role of separating fact from fiction?
Um, we do our best. There are certainly a ton of rumors, a ton of misinformation going around. I know that at the beginning of the pandemic, when we had no cases in Leeds, Grenville, Lanark, there was a rumor going around that there were no cases because there wasn't testing going on at all. There's been various rumors about, oh, there's been an outbreak at this home. So that aspect of the job has a lot to do with going to the people who are able to answer these questions accurately. So, for example, Dr. Paula Stewart, who I talked to before, asking her, is there test, like people are saying there's no testing being done. Is this the case? So just having her dispel that rumor, I know a lot of people really appreciated that story. So, and also working with our team at the Toronto Star. So they have a lot of stories. Like there was one today. Okay, don't drink bleach, but here are a bunch of other myths that are going around, a bunch of other things that people are saying that you should do that you really shouldn't do. So in my role, I will go onto their site and I'll pick up stories from them that are like that, that are kind of maybe written in by the Toronto Star team, but also equally apply to our people here. So working with local authorities, getting the facts from local authorities at that level, but then also adding things to our site and sharing things with our communities that will further dispel those more widespread rumors.
Say you get something that is really, really bad advice, something horribly dangerous, as you mentioned, drinking bleach. Do you just not publish bad information, or do you have to go out and say this has been said? Please don't listen to it.
I think it depends upon who's saying it. So I think obviously in the case of Donald Trump making those claims, that has to be addressed by the media. It has to be reported because the story is the president is saying these things on national television. If, Joe Schmo on the street is, standing on a soapbox telling everybody to drink bleach, then in that case, we probably wouldn't report it because it's not really a public health risk. But if millions of people have already heard it said, then you kind of have to acknowledge it so that you can dispel it. And I mean, another good example that happened just recently was in the town of Smiths Falls. We've been reporting on a controversial event that happened where some citizens were upset that construction workers on Beckwith Street weren't wearing PPE. So, and then some people were there taking pictures of it and ranting on social media. So obviously we covered that. But then the police chief in Smiths Falls went on kind of a social media rant about how the people that were posting these pictures were being, um, just an embarrassment to the community and all this stuff. So it's one of those things again where if Joe Schmo had called these people an embarrassment to the community, we probably wouldn't report on it. But if the chief of police goes on to Facebook and goes on this big rant and names specific people that he's displeased with, it kind of makes it newsworthy. So yeah, very much depends on who's saying it in that instance, but also in the instance of people telling you to drink bleach.
When this is all over, how do you see the recovery happening in your community, and what do you think your role is going to be in that?
I think our role will continue to be to report the facts and tell the stories. In terms of how recovery will look, I don't know. I mean, I don't know any more than the next person. I fear for how the smaller communities that I work in will be affected. Um, I think no matter what happens, our role will continue to be to get the information out there, get the facts out there, tell the stories, and document what happens so that future generations can look back on these stories and that people can be comforted by the stories of incredible humanity that's coming out. I think that's a really important role too, is giving people hope by not just telling the bad stories, but also finding those stories with heart that kind of show how people are coming together. Because if we don't believe that we will get through this, we're not going to get through this. So we have to maintain our high spirits and our belief, and that, so that I see us as playing a role in keeping the spirits up while balancing that with a healthy dose of facts and what's realistic.
Finally, one important question, really important. How are you and your family holding up in all of this?
We're doing okay. It's a little bit of a challenge because I have two young children, so trying to have both my husband and I work from home while they're both here, while trying to homeschool my 8-year-old and keep my 3-year-old from bombing all my Zoom calls, and you know, so it's definitely a challenge, but we're doing okay.
Good
Yeah.
stuff. Alrighty. Well, Hollie, thank you very much for taking the time to speak with me today. Good luck with everything that's happening, and keep letting the people in the Ottawa Valley know what's happening. And please be safe.
Thank you, Bill. You too.